I'm Kelley Argraves. I'm Scientific Director for the Clear Cell Sarcoma Foundation. Lisa Faulkner and I are at CTOS 2025 and want to show you our poster, which represents the electronic health records project that our foundation has been working on for the past few years. This is an update. We're discussing outcomes in clear cell sarcoma from our electronic health records in a patient-led registry. So we have 21 patients represented in the project this year, and it's continuing to grow. So we'd love your continued participation. We want to thank all the patients that have given us access to their data. And the idea behind this project is to accumulate data and show trends in treatments to help doctors and patients make decisions going forward. So with our 21 patients, this first graph shows the time in survival in years of patients based on their treatment. So the first set, which is dark blue, is showing patients that receive surgery only. And as you can see, we have patients that are living 25, 30 years in this group. And then we have surgery. And by the way, this is some of these patients are alive, and we will continue to follow and show updated progress with these treatments. The next group is surgery and radiation therapy, and also we have some long-term survivals in there. The third group is surgery and systemic therapy, so all these patients are alive and we'll continue to follow them. The last two groups are surgery, radiation therapy, and systemic therapy, and then the last group is radiation therapy, immune checkpoint inhibitors, and how this person was not able to receive surgery. And sadly, these patients have passed. But this is our group so far that we're looking at. This graph is showing the difference between resection for the surgery versus amputation. And in our groups, we didn't see a statistically significant difference, but we'll continue to follow that group. The next group is showing radiation therapy versus no radiation therapy. And again, we didn't see a statistical significance in that group, but we'll continue to follow. And in these graphs, if you notice, there's some red dots versus black dots, and so the red dots are patients that have died. And this group is showing patients that have lymph node, either node negative or node positive groups. And again, we didn't see a significant difference in those groups. And the last two graphs are showing data on therapies. So this is an immune checkpoint inhibitor therapy, and what we see as in the first group, these patients have received immune checkpoint inhibitors. So this therapy, there is a significant difference between survival time for this group and the ones that have not received this therapy. We haven't separated this out into metastatic patients versus localized, and this is sort of a first blush preliminary data analysis. So we'll continue to break down these groups into smaller groups to discuss this, but at this time, these patients are not surviving long term with this therapy. Same with chemotherapy. Now this chemotherapy is in the literature, and so our data is basically supporting the fact that chemotherapy has not been an effective treatment for clear cell sarcoma. So this bar represents the average time these patients are surviving that have been treated with chemotherapy versus those that have not been treated with chemotherapy. So we're basically collecting this data, and we're hoping to share this with doctors as we get it and publish it as we get more patients in the group. We'd love it if you'd go to the foundation website and look there for more information on this. There's a lot of work that goes into this. The data is very complicated, and often the data we get from the hospitals has inaccuracies or missing data. So our team is working really hard to make sure that the data that we're sharing is accurate and informative to patients and physicians. So, thank you.